Does pet therapy requiring certification? When it comes to pet therapy, especially regarding emotional support animals, many people wonder if certification is necessary. The short answer is that emotional support animals do not requiring formal certification in the legal sense. However, there are some important distinctions to understand. Emotional support animals, or ESAs, provide comfort and support but are not classified as service animals under the Americans with Disabilities Act. This means they do not have the same legal rights as service dogs. To qualify for an ESA, a person must obtain a letter from a licensed mental health professional. This letter confirms that the individual has a qualifying mental health condition, such as post-traumatic stress disorder or anxiety. While this letter serves as documentation for the animal's supportive role, it does not equate to certification for the animal itself. Now, let's talk about service dogs. These dogs are specifically trained to assist individuals with disabilities, including psychiatric conditions like PTSD or anxiety. Service dogs must perform specific tasks that help mitigate the handler's disability. Unlike ESAs, service dogs do have legal protections that allow them access to public places. However, there is no federally mandated certification or registration required for service dogs under the Americans with Disabilities Act. Handlers can train their own dogs or seek out organizations that provide training. Some organizations offer training programs and certifications, like the American Kennel Club's Canine Good Citizen Test, but these are not legally required for a dog to be recognized as a service dog. The key requirement is that the dog must perform tasks that assist the handler. It's also important to differentiate between therapy dogs and service dogs. Therapy dogs often visit hospitals, nursing homes, or schools to provide comfort to many people. These dogs typically undergo certification through therapy dog organizations. This certification is focused on the dog's behavior and suitability for therapeutic settings, but does not grant the same legal status as service dogs. Therapy dog certification is relevant for those who want to participate in formal pet therapy programs, but it is separate from the requirements for service dogs or emotional support animals. For individuals managing PTSD or anxiety, having a psychiatric service dog can be incredibly beneficial. These dogs are trained to perform tasks that help alleviate symptoms, such as interrupting harmful behaviors or providing a calming presence. While there is no official government certification required, rigorous training and testing by reputable organizations can enhance the dog's effectiveness and ensure compliance with public access laws. Emotional support animals only requiring a letter from a mental health professional, with no training or certification needed. Therapy dog certification may be pursued for organized pet therapy activities but is not necessary for personal emotional support or service dog status. In summary, pet therapy involving emotional support animals does not requiring certification of the animal itself, only professional documentation of the handler's condition. Psychiatric service dogs need specific training to perform tasks related to the handler's disability but do not requiring formal certification or registration to be recognized under the Americans with Disabilities Act. Therapy dogs used in formal pet therapy programs often undergo certification, but this is distinct from the requirements for service dogs. For managing PTSD and anxiety, the focus should be on appropriate training and professional evaluation rather than official certification of the animal.